Hello, everyone. Welcome back to another COVID-19 law and policy briefing, which are produced by Public Health Law Watch, a George Consortium initiative housed in the Northeastern University School of Law. I want to thank, as always, our co-sponsors, the Center for Public Health Law Research at Temple University, the Network for Public Health Law, Change Lab Solutions, and the APHA Law Section. So as we always do, we are here to provide expert legal analysis during the COVID-19 pandemic, and hopefully to answer some of your burning questions about issues that are ongoing right now. For more information on the COVID legal response, please also check out our report, which is called Assessing Legal Responses to COVID-19, available at www.covid19policyplaybook.org. The report, which came out last summer, has chapters on 36 different topics related to the legal aspects of the COVID-19 response. And I'm very happy to announce that we're very close to being done with our volume 2 of that report, which should come out in about a month or so. So stay tuned for that as well. As part of making sure that we can remain informed on all of the important legal issues related to the COVID-19 pandemic, we have two very special guests here with me today. I'm Lance Gable. I'm an associate professor at Wayne State University Law School. Joining me today are Professor Ross Silverman, who's a professor of health policy and management at Indiana University Fairbanks School of Public Health and professor of public health and law at Indiana University McKinney School of Law in Indianapolis, and Jill Krueger, who is the director of the northern region of the Network for Public Health Law, coming to us from Minnesota. So please use the hashtag COVID Law Briefing for any questions or comments in response to the briefing. So today our topic is all about the states. For most of the pandemic so far, states have largely been on their own, with the federal government taking primarily a hands-off approach during the Trump administration, or in some cases an antagonistic stance towards some state efforts to respond to the pandemic. And as a result, states have had to improvise. They've had to, in some cases, compete with each other. And the resulting impact has been very different outbreaks in different areas, very different levels of resources and availability of strategies or use of strategies in different areas. And now that we have the Biden administration in place, which has a more aggressive and coherent response, hopefully more coordinated, from the federal level, we're also likely to see some changes into how states are responding to the pandemic. Most of the focus in the media over the past couple of weeks has really been on the vaccination campaign, the rollout of COVID-19 vaccines, appropriately so. But there's a lot more going on in addition to that at the state level. And if you think back to earlier in the pandemic, we had lots of discussions on these briefings about other state intervention strategies, capacity for COVID testing, contact tracing, other kinds of distancing measures, et cetera. And so what I wanted to focus on, at least to start with today, is the question of how states are doing on some of those other non-vaccine aspects of COVID response. And so my first question goes to Ross. We know that states had varying levels of success in implementing those kinds of strategies like testing and contact tracing earlier in the pandemic. And so my question to you is, what is going on with those other strategies right now at the state level? Have states improved? Have states jettisoned those kinds of efforts as vaccinations have started to come online? What's going on at the state level? And also, what are some of the legal issues that have been arising at the state level on these topics?
Sure. So thank you, Lance. It's a pleasure to be here and to participate as part of this process, and getting involved with the education programs that you all are providing through these services and through these publications. So just want to take a very short course through the process of testing, tracing, and isolation. And, traditionally, when we have infectious diseases as part of the infectious disease control process, first and foremost, you want to make sure that people can get tested and determine whether or not they have the infectious disease. When people do have a positive test, the process generally is that they will then be contacted by a representative from the public health agencies, who then will want to try and figure out where that person recently has been, so that they can assess and who that person has been associating with recently, so that they can then get in touch with those other folks that may have been a close contact so that they can encourage those people to also get tested, and that both the person with the positive test, that they can take the steps necessary to isolate themselves so they don't spread the infection further, and so that the people who may have been exposed can get tested as quickly as possible so they can find out what next steps they may need to take. What we found over the course of the process regarding the law is that the laws are pretty straightforward. These are fundamental services that are provided in infectious disease control at the state and local level. States and local health departments ramped up development of contact tracing programs. There's a lot, as you mentioned, there's a lot of variety in what was done at the state and local levels, but I think we can say uniformly that these programs have been completely overwhelmed. And we can get into that in a little bit as to all the reasons why they were overwhelmed. But what we found is with the massive numbers of positive tests that have come forward, there aren't nearly enough contact tracers to be involved to actively do all the, not just the reaching out to the people who test positive, but also in collecting all of the data they would like and then reaching out to the potential contacts. In fact, in some jurisdictions, we found that the local health departments were encouraging the people who tested positive to go do their own contact tracing and to reach out to other people who they think they may have come in contact with to let them know what might be going on.
Now, was that driven by lack of capacity, not enough people available within the health departments to do that kind of work, or was that driven by practicality, that the idea that maybe people reaching out themselves would have more likelihood of getting a response to that outreach?
It's a good. Well, you raise one of the concerns that has come up in this pandemic, which is trust in the public health authority and cooperation with public health interventions. There is a lot of that's been a challenge in this response effort. This is more of a practical determination, however, by the local health departments. There is a point at which contact tracing is no longer really feasible in this process. And we hit, especially with the wave that started around Thanksgiving, we really just had state and local authorities overwhelmed. And what we have now also, as we've moved into vaccine delivery, is a lot of folks have had, this hasn't been a resource expansion. It's actually just been a shifting of personnel in many situations from contact tracing into vaccine delivery at this point.
So a related question on a slightly different topic in terms of state interventions. Historically, when there have been infectious disease pandemics, a lot of focus has been put on legal powers to use quarantine and isolation as strategies to stop the spread of disease. And I know that quarantine powers have been used, or at least voluntary quarantine strategies have been applied, especially for people traveling across state lines or traveling across international borders. But it seems like quarantine and isolation have been less prominent as a strategy compared with other kinds of distancing during the COVID-19 response. And I'm wondering what's going on with the use of those kinds of powers at the state level, and what explains the difference this time compared with maybe some previous kinds of pandemics like this?
Yeah, so I think one of the things that we're finding is public health has almost universally adopted a voluntary participation approach, both to the quarantining and isolation component, as well as to the participation in the sharing of information about contact tracing and the like. Really, again, a bend but don't break kind of an approach. They don't want to overwhelm people. You don't want to scare people off. You do want people to report and share. But the nature of this virus itself, it's a lot of it is pre-symptomatic or asymptomatic spread, has overwhelmed the system, so it's spreading faster than we can track how quickly it has spread. The access to testing itself has been an issue, and so it hasn't been as readily available as or the response rate is not quick enough so that you can really get stop the spread before people have come in contact with a huge array of different folks. There have been challenges with isolation and quarantine. We find some significant equity issues coming up here. The Pew charitable trusts, their survey arm did a survey back in the fall, and they found the vast majority of people say they would isolate if they got a positive test. If they were told you've got COVID-19, you need to stay home for 10 days, they'd be willing to do it. But about a third of people said it would be difficult for them to do that, either because of their living conditions or their work situation. And we really haven't done enough as a system, through supports and through protections, to make sure that people can can successfully manage that. And then finally, we do have the big a number of these trust issues. I think that has created concern. I mean, we should let people know, as far as privacy and confidentiality is concerned, the contact tracing process is a very highly protected process as far as confidentiality and protection of your information is concerned. And the core part of the training in contact tracing is to make sure that we value people's privacy, and we're only collecting information that is essential to our understanding of how the virus is spread. But there's distrust every place right now, and so that has really undermined people's willingness to participate, willingness to adhere to the recommendations, and really has has undermined a lot of these processes, even as they were able to be involved in response. I think as the numbers come back down again, we'll be able to use contact tracing more as kind of a spot, spot busting kind of a situation to stop clusters, and to try to shut things down that way. But this is spreading so quickly, and it spreads without a trace, really, that it's going to be difficult for us to use it as a central component the way that, say, it was used in Ebola.
Okay, thank you. I want to turn our attention over to Jill for a few minutes, because there's a topic that I know she's been following really closely, and I want to highlight a little bit during our conversation today, which is the issue that's arisen in many states between legislatures and executive branch officials over use of public health powers or emergency powers to respond to COVID-19. There have been some quite high-profile conflicts between the different branches of government that are centered around these uses of political power to issue executive orders and other kinds of intervention strategies. And so I wanted to start with just asking, what sorts of disputes are we seeing at the state level within government and between government branches, and how have courts handled them so far?
Thanks, Lance, and thank you for having me on this briefing as well. I really appreciate the opportunity. And yeah, we certainly have seen some high-profile conflicts over the use of emergency powers in quite a few states, and those conflicts have really covered a lot of territory. From whether the executive branch has authority to address the COVID-19 pandemic, what the nature of that authority is, and who within the executive branch has the authority? Is that the governor? Is it the secretary or commissioner of health? Who has the authority to act? And if one, if the governor's authority is constrained, might the secretary or commissioner of health still have some other independent or surviving authority? What is the origin of the authority? Does it rest in, sort of a modernized Public Health or Emergency Powers Act, enacted in the 21st century? Or, in Michigan, we saw a case that detailed, that involved analysis of statutes from the 1940s, sort of civil defense era statutes. And the way those statutes were drafted is different. So we've also seen just, concerns about procedural constraints. How can the executive branch act? Is it through an order? Is there rulemaking required? What kinds of, does the legislature have any role? Does it have an oversight role? Can it terminate an order issued by the executive? Can it impose, any time limits upon an order once that order has been issued? I mean, separate question of, in terms of drafting a statute. Are the orders renewable? Were they intended were these emergency powers intended for an emergency that, now is approaching the 1-year mark? And so you asked about court cases. So those just sort of rattling off some of the types of conflicts we've seen, and then how we've seen those play out. In many of the states, courts have taken a fairly generous view to the authority of governors and state health commissioners and secretaries to issue orders related to community mitigation measures, even where the state laws really were, didn't have anything specific about masking or social distancing, or sometimes even very much about business closures or closures of houses of worship. Many of them have more specific language about something like school closures. But in many states, the courts have taken have relied upon broad delegations of emergency powers by state legislatures. For example, in Grisham v. Reeb, the New Mexico Supreme Court upheld the Secretary of Health's emergency orders, and actually including provisions authorizing imposition of criminal citations and civil administrative penalties to enforce those business restrictions and closures. But of course, there are some cases that have gone the other way. And I grew up in Wisconsin, and in Wisconsin, we saw the state legislature challenge the order issued by the designated to be the Secretary of Health on several grounds, and many of those were sustained by a 4-3 majority of the Wisconsin Supreme Court. And that case was Wisconsin Legislature v. Palm. And the court there held that the order issued by the secretary was in fact a rule. And so it wasn't enforceable because it had not gone through the rulemaking process. And I already referred to the Michigan Supreme Court case. And in that case, the court found that, the civil defense 1940s era statute was unconstitutionally overbroad. And the court found that it delegated essentially all of the state's police powers to the executive branch, and essentially allowed discretion over an entire economy, and said, we're going to need more precise guardrails for that kind of authority from the legislature. Now, of course, those Supreme Court cases haven't been the last word. We've seen the governors and public health officials in states like Wisconsin and Michigan continue to search for ways to exercise authority, even if it's in a more narrow or limited way, and to see the legislatures continue to seek to constrain that authority.
Yeah, and I wanted to follow up on that last point, because obviously one of the things that's driving these conflicts is underlying political disagreements about what the right response should be, and how much restrictions should be placed on different aspects of people's activities to try to contain the virus. And some of these larger questions end up getting subsumed to a lot of general political conflict that goes on in other areas as well. But you mentioned that legislatures and executive branch officials are continuing to have these disputes about power, and that some legislatures are beginning to try to change those underlying statutory authorities or regulatory authorities. And so what are some of the new developments along those lines that have been happening in the last couple of months?
Sure. Now that's something we're really interested in tracking. We work with public health officials in all 50 states of the network. And so we're hearing word about some of these bills that have been introduced. Now it's interesting, probably at least half of the states, it's hard to get a precise count of bills introduced. Every state legislature is meeting this year. And the volume of bills is really high, shall we say. There's, especially after sessions were cut short last year and the like. In any case, there was a lot that was introduced last year, but the main sort of bill that passed last year were limitations on the liability of businesses that might arise in relation to the spread of COVID-19. So that's interesting and not really to do with state or local public health authority. But so the sorts of bills that we're seeing, that are still pending, some of them would just remove authority from local health officials, local health boards, and the drafting of those can vary. Some of the bills are strictly about removing the authority, emergency authority from local health officials or state and local health officials. Some are drafted in such a way as to seem quite broad, so that you'd have, you have to wonder, would city councils be overseeing restaurant inspections and fairly routine public health activities, which I can't imagine those legislative officials would be eager to have. Some of the bills would require the elected officials to approve of local health official actions. There's a bill in Tennessee that would prevent the governor and local government from classifying businesses as essential or non-essential for the purpose of issuing orders that might differentiate among those categories. There's a bill in Texas that would define places of worship as essential. There are bills in a number of states that would prevent local mask mandates. Bills in several states that would address school closures and perhaps shift the responsibility, the decision-making authority from public health officials to school officials, to local school boards on whether or not to close schools. And again, those bills can vary in how they're drafted, how narrowly or broadly they're drafted.
So,
whether it's COVID-19 specifically or any infectious disease outbreak.
Yeah, so I wanted to ask then, so with all of this churning potential legislative and regulatory change out there that's being driven by COVID response and the different positions on who should be making those decisions, what are the short and long-term implications of this for public health?
Oh gosh.
and quickly, because I think we only have a couple more minutes. But like,
okay.
So I guess what are the key takeaways from this? Like, what should we be, as people who are interested in public health law and policy, be focused on, and what are the potential outcomes of some of these kinds of initiatives?
Well, I mean, just one really brief thing I can say is Lindsay Wiley has called for democratizing the law of social distancing and sets forth 6 principles in a blog in Health Affairs that I really hope will be influential and widely read. I mean, I think we probably shouldn't make these decisions in haste. The Uniform Law Commission has a study committee, several study committees related to emergency public health powers that will make recommendations in July as to whether the Uniform Law Commission should appoint drafting committees. We've had, Kentucky and Pennsylvania have been looking on, and other states as well have been looking at appointing task forces. I mean, that might be a way to have the stakeholders come together and really talk through this in a transparent way. We know that transparency can help us get buy-in. We know that we need to call on people's sense of altruism. I mean, I think Ross was kind of talking about this as well, people's desire to help the community. And we have to acknowledge reasonable concerns. And, to the extent we can create, we talk in public health a lot about making the healthy choice the easy choice. Are there ways that we can do that with supports? With, if people have to stay home, how can we make that financially feasible? How can we provide broadband access if people have to do remote learning with their kids? So I think there's lots of lessons to be learned, and the learning will continue on past this legislative session.
Well, thank you. Those are all really good points. I want to give Ross a chance to have a final word as well. What should states be focusing on right now? What should we all be focusing on right now?
Sure. Well, I mean, one of the things that is good to see is right now there is national coordination that is going on, and funding that is being proposed, and resources that are coming to the states in order to address the current pandemic. I think one of the challenges we're going to run into is, how much is going to be fighting over this pandemic, and what's going to be left in place to address the next pandemic. And so on the one hand, we want to make sure that we don't narrow these laws too much and then tie our hands when a completely different type of issue arises the next time. And I think the second part is local funding. Every state is going to have a big hole in their budgets, making sure that public health is adequately supported going into the future, and that any rivalries or bitterness that might be arising right now doesn't also translate into massive cuts to public health services, I think is going to be something we need to watch out for as well.
Okay, well, I want to thank both of my guests so much for joining us today, Jill Krueger and Ross Silverman. And I want to thank all of you for tuning in. We are going to be doing these briefings here on Twitter just about every Tuesday and Thursday at noon Eastern. You can go to @PublicHealthLawWatch or search #COVIDLawBriefing to find these briefings. Recordings are also available on the Public Health Law Watch website, and the shows are archived by the Week in Health Law podcast, which is www.twill.com, TWIHL. The COVID law and policy briefings are produced by Faith Kallick and Liz Voiles. And thank you again. We'll see you next time. Please stay safe, wash your hands, double mask, keep your distance whenever you can. And when that vaccine appointment opens up for you, please get vaccinated. Thank you.
Thank you.